Hello everyone, welcome back to my channel. In this video I am discuss about the thoracic vertebrae. So we have 12 thoracic vertebrae and they are divided into two types, typical and atypical thoracic vertebrae. Typical thoracic vertebrae, they bear the similar characters, while atypical thoracic vertebrae, they are different in their special features. So first I will discuss about the structure of a typical thoracic vertebrae. A thoracic vertebrae can be identified with the help of these costal facets on the body and the transverse process. So these costal facets are for the articulation with the rib. So these typical thoracic vertebrae can be identified by these costal facets. Then we come to the body. The body of a thoracic vertebrae is heart-shaped, that is, anteroposterior diameter is more than the transverse diameter of the body. On the body, the lateral aspect, it is bearing the demifacets. These are the costal demifacets. This is the superior demifacet, which is larger, and it articulates with the head of the numerically corresponding rib, while the inferior costal demifacet is smaller and it articulates with the next lower rib. Then we have the vertebral foramen. This vertebral foramen is circular and it gives passage for the spinal cord. Then we have the vertebral arch. This complete structure except the body is comprising of your vertebral arch. This shows the pedicle. These are the pedicles, these bony bars. They are directed straight backwards. The superior vertebral notch is shallow. Here we can see this is the superior vertebral notch and this is the inferior vertebral notch. So this superior vertebral notch is shallow while the inferior vertebral notch is deep and conspicuous. Then we have the laminae. These are the bony plates which are termed as laminae. They overlap each other from above. When they articulate with each other, there is overlapping of these laminae. Then we have the superior articular processes. So these are the superior articular processes directed upwards. Then the articular processes, they have bearing articular facets. So these are the articular facets of the superior articular processes. These articular facets are flat and they are directed backwards. This direction permits rotatory movements of the spine. Then we have the inferior articular processes. These are the inferior articular processes on the inferior aspect. They also bearing the inferior articular facets. These are the inferior articular facets. These are directed forwards. So these facets, they are directed forwards. Then we have the transverse processes. These are the transverse processes. As we can see, these transverse processes are large and they are directed backwards and laterally. Then the anterior surface of each process bears a facet at its tip. This is for the articulation with the tubercle of the corresponding rib. In the upper 6 vertebrae, the costal facets on the transverse process, they are concave and face forwards and laterally, while in lower 4 the facets are flat and face upwards, laterally and slightly forwards. So in the last 2 vertebrae, the articular facets are absent. Then we have the spine. This is the spinous process. This is long, it is directed downwards and backwards. As we can see the direction of this spinous process. The 5th to 9th spines, these are longest and more vertical and they overlap each other. The upper and the lower spines, they are less oblique in direction. Then we come to the attachments. The upper and the lower borders of the body, this is the upper border and this is the lower border of the body. This gives attachment in front and behind to the anterior, and over here we have the attachment of anterior and posterior longitudinal ligaments. So on the anterior side of the body we have the attachment of anterior longitudinal ligament, and on the posterior surface of this body we have attachment of posterior longitudinal ligament. Then the upper borders and the lower parts of the anterior surfaces of the laminae over here we have attachment of ligamentum fleva. So on the laminae we have attachment of ligamentum fleva. Then on the transverse process we have attachment of costotransverse ligament. There are 3 costotransverse ligament. Let me show you with these ligaments with the help of diagram. So here we can see the attachment of lateral costotransverse ligament, which is attached on the tip of the transverse process. Then second one, this is the inferior costotransverse ligament, which is seen from below. Then this is the superior costotransverse ligament, seen from the superior side as well as from the anterior aspect. So this is the superior costotransverse ligament. Also, intertransverse ligaments and muscles are attached to the upper and the lower borders of the transverse process. The levator costae lies on the posterior surface of the transverse process. Then the spines gives attachment to supraspinous and interspinous ligaments. Also it gives attachment to various muscles like trapezius, rhomboids, latissimus dorsi, serratus anterior superior and serratus posterior muscles, which are the muscles of back. So this is all about the structure and the attachment of typical thoracic vertebrae. I hope you understand well. Thanks for watching.